MDedge are about to give you kind of a quick summary wrap up of what was a pretty big deal. The CDC's telebriefing, kind of a national update on measles and where we stand with the outbreaks. A lot of folks were here, were on the call. We had HHS Secretary Alex Azar. We had HHS's Assistant Secretary for Health. We had the CDC Director, Dr. Robert Redfield. We had Dr. Ann Shukett. We had the big names in the nation's health field, and they're really focused on what, on the face of it, seems like a relatively small number of cases, but this was a disease that we had eradicated in the United States as of 2000, and it's back. So here's kind of the here are the bullet points from today's telebriefing. Up front, Alex Azar says, as of Friday, there have been 704 cases of measles this year so far in 2019, and we are only in, we're not even out of April yet. That's a lot of cases. That, in fact, is the record now since 2000, since we eradicated measles from this country. And again, it's only April. CDC says there will be more. There are going to be more cases. Fortunately, so far, we've had no deaths, which is a great thing. But if this keeps going up, there's no guarantee that that number will remain at zero. The CDC also offered an interesting stat. The average price tag for a measles case is $32,000. So this preventable disease, each case is costing this nation, this nation's health system, $32,000. Where's the virus coming from? Again, this has been eradicated from the U.S., so it's coming from outside. It's travelers from outside who are bringing this into the country. Top 3 countries from which the virus is traveling: Ukraine, Israel, and the Philippines. So what do you as a physician need to know about this? One of the more interesting things, an infected person can transmit the virus up to 4 days before they themselves kind of develop that hallmark rash that we all, well, some of us would have recognized back in the olden days as measles. Dr. Redfield, the CDC's director, he says that normally they don't recommend the MMR vaccine in infants until 12 months of age. But because of what's happening, they're now recommending that infants 6 months of age who are traveling, again, that's not all infants, but just particularly infants who may be at greater risk of developing it because of where they're going to be at, those infants 6 months of age who are traveling should get the MMR vaccine prior to traveling. The CDC is also recommending that folks who are traveling to high-risk areas, that they make sure that they are fully vaccinated. So if you haven't been vaccinated for measles, you need to be fully vaccinated at least 2 weeks before you travel. So as a physician, what should you see as acceptable presumptive evidence of immunity against measles in your patients? You need to have at least one of the following. You need to have written documentation of adequate vaccination. You need to have them showing that they've had 1 or more doses of a measles-containing vaccine administered on or after their first birthday for preschool-age children and for adults who aren't at high risk. So if you're not in an area of high risk, you're not living in Brooklyn, you're not in parts of Oakland County in Michigan, for example, right now, Washington State, you're probably going to be okay. 2 doses of measles-containing vaccine for school-age children and adults who are at risk. So if you are in an area where there potentially is an outbreak, you as a physician need to see evidence of 2 doses of vaccine for school-age kids and adults who are at risk. That includes college students, that includes healthcare personnel, and that includes international travelers. Again, the travel thing is a big deal here, and that's really where the risk is coming from. You need to have laboratory evidence of immunity, laboratory confirmation of measles. Some of us are old enough that you could have caught measles because you weren't getting the vaccine because it didn't come around until 1963, I think. Or one other factor showing where you can presume that there is evidence of immunity, someone born before 1957. A couple of other points. That's kind of the wrap up. One dose of MMR is 93% effective against measles. So ideally, you want the 2 doses. But if you've only had 1 dose, if your patient's only had 1 dose, that's 93% effective against measles. Reach out to the parents of patients and talk with them about this. Talk. You are the front line in communicating the potential dangers. I mean, you don't have to scare people, but you do need to make them aware of the risks here. And you as a physician should reach out to folks, to the parents, and explain the risks. The CDC, there's a lot of vaccine hesitancy that is sparking a lot of has kind of kicked the door open here for measles. The CDC has tools on its website, probably cdc.gov. We'll post the actual address shortly, but go there. There are tools that you can use to kind of overcome the vaccine hesitancy among parents, particularly parents who may potentially have kids in high-risk areas, high-risk situations, so that you can help them understand the value of getting the measles vaccination. 74 cases, again, 704 cases. And again, the CDC expects that there will be more cases of measles this year. So we're not done yet. The only question is how effectively we can get the message out that vaccination needs to happen, how effectively we can overcome the vaccine hesitancy, and how effectively we can counter a lot of the misinformation that has fueled these outbreaks. Let's see. The CDC's Dr. Ann Schuchat wants to make sure that adults understand if they have questions, they need to talk to the healthcare providers. And she also noted that in the telebriefing today, adults who are not traveling, you should be reassured that you are protected. If you've had if you meet those parameters that we talked about earlier, you've had at least one dose of the vaccine, preferably the 2, or if you were born before 1957, you're protected. Clearly, there are some times where the vaccine's not 100% effective, but if you've taken those steps, if you've made sure that your patients have taken those steps, they are highly protected against infection. And we will have an article coming out soon, I've just been told, outlining in detail what was discussed today at the telebriefing and kind of giving you some more details, and most important, giving you some resources that you can turn to as a physician to help patients understand what steps they can take to protect themselves and to protect their children from what is a very preventable disease. So thank you very much for taking time to watch. And again, follow our feed, and we'll have lots of helpful information, lots of helpful resources to make sure that you can keep your patients safe. Thank you very much.